There was some hesitation. I think there is still a little bit with some providers, but they're, I think they've also seen that it hasn't changed. I mean, it hasn't changed our clinic. We haven't turned into a different clinic. It's the same clinic,
When Dr. Collier and Joey initially asked me about doing medication-assisted treatment, I said no, I don't want any part of that. Something sent me there. Maybe it was a God thing, I don't know, but there's a little voice that said, you really should do this. I think the day that probably got through to me was they had found a 70% reduction in deaths and 70% reduction in relapse with their program. And when he said that, a little switch came on, and I thought, that's something I probably need to do.
But MAT versus non-MAT, they have this tool that helps to reduce their cravings to a level that they can manage. And then we can actually get them engaged in the 12 steps, engaged in meetings or groups or therapy long enough to where they realize what it's doing for them.
We know that this is a huge need in our community. We know that this is a huge health need, and health centers exist to meet the needs of their community. To cross that bridge to where we started doing medication, offering medication as well, was a huge step for our organization. And we talked about it, and at some point we had to say, we're going to do it. We had some really good models from other health centers in the state, so we took what they were doing and were able to just adapt it and try to shift it to what it would look like here.
How I got our board members on board, really talking about the people, talking about this success story and that success story, and how our patients have benefited, that we know that they would be dead if we didn't have this program and we weren't working with them. And so really talking about those changed lives has really brought them around to have more an acceptance to our program.
So I feel like the patients that are in the MAT program, I get to kind of see them full circle. I see them in the beginning and then through their prenatal care sometimes. And then also I get to see them at the hospital after they've had the baby. So what I really like about that is the continuity of care. It has been good for our patients here. It has been good for our staff. It is good for me as a provider to have those resources. So yeah, the resources are great for the patients, because that's the main goal, but the resources are great for me as a provider too, to have the behavioral health staff to help me.
I would just say to learn all that you can about MAT before you make any judgments about it. Work with the clients, see the changes that they have in their life, because a lot of these clients are the same ones you've been seeing for years. That are coming in and out of the system, and then to finally see them do well, that just proves that this is something that is needed.
This is not just a walk in and get your medicine and go out. This is like people that care, that are passionate about you, and a team that's going to help you get the health care that you need. And we're not a Suboxone clinic.
Every day we hear someone connected to our clinic dying from overdose, so that's why we started the MAT program here. Just to save lives, give them a time to build a program so they can live a whole life.
You save one life, it's worth it. You see one person get their kids back, or one person that was on the verge of dying of an overdose that is pushing their kid down the hallway. Yeah, it's worth it. Just one at a time.
The stories that have come out of this program are just incredible. There's mega systemic impacts of really doing this work. And so you think about it, just the impact goes from a small, like a one-person level, but you see it impact the whole community. Providing primary care in a community health setting is hard work. And providing medication-assisted treatment in primary care is hard work as well, but it's rewarding work, and you don't grow if you're not challenged. And I think that has really been what we've seen through this.